Heart failure in a 28-year-old often looks nothing like heart failure in a 78-year-old, and that difference is exactly why it can get missed. And if you're young and you've been told that you have heart failure, or you're still waiting for someone to properly explain what's wrong with you after months of being told it's stress or a virus or anxiety, then I want you to know something important. What you experienced may not fit the picture that most people and even many clinicians associate with heart failure. And that doesn't mean it wasn't real. It means the picture that most people carry in their heads is incomplete. This video was requested by one of you. Someone who's living this asked me to explain it properly, so let's do that. I'm Dr. Jodie Ann Senior, a cardiologist and heart failure specialist. By the end of this video, you'll understand why young patients with heart failure often present completely differently to older patients, the specific signs that get missed or misattributed to something else, and why this matters for how quickly you get diagnosed, and what to ask if you suspect something is wrong and you're not being taken seriously. Let's start with why this happens, because understanding the reason changes how seriously you take your own symptoms. Most people, including many doctors who don't specialize in heart failure, carry a mental picture of what this condition looks like. Swollen ankles and legs, breathlessness climbing upstairs, needing extra pillows to sleep, waking up gasping in the night. All relevant. And when we examine these patients, there are telltale signs like obvious fluid in the feet or ankles, crackles in the lungs, telling us that fluid is there. And maybe they have this story of recent sudden weight gain. That picture is accurate for a great many patients, particularly older patients whose heart failure often develops gradually and predominantly with fluid overload and signs of it. But that is not always the picture that younger patients have. And when a 25 or 35 or 45-year-old walks into a clinic without the swollen ankles or legs, without the obvious breathlessness lying flat, without the fluid overload that fits the textbook picture, heart failure often simply isn't even considered. Something else gets blamed instead. Let me walk you through what the presentation often looks like in younger, previously fit and healthy patients, because this is the part that matters most. Young patients with new heart failure, often from a cardiomyopathy, meaning that the heart muscle itself has become weak, frequently don't present with fluid overload at all, or only minimally. Instead, the picture is often built around low blood pressure, sometimes significantly low, and this is this low cardiac output syndrome. I have seen young patients present with a systolic blood pressure in the 70s, a number that would be alarming at any age, but which in a young, previously fit person is especially easy to misattribute to dehydration, a virus, or simply being run down. And it is often missed because no one bothers to check it, as young, previously healthy people can compensate for this severe change quite well for a while. Alongside that low blood pressure, the symptoms are often vague and non-specific in a way that doesn't scream heart problem to anyone. Persistent fatigue that doesn't improve with rest, unintentional weight loss, a loss of appetite that's hard to explain, sometimes discomfort in the right upper quadrant or right side of the abdomen, high up, which is actually the liver becoming congested and swollen as blood backs up from a struggling heart, but which gets mistaken for a digestive issue, a gallbladder trouble, or stress. The classic nighttime symptom of heart failure of waking up gasping for air is less common in this group. Occasionally, in more advanced presentations, there could either be frothing in the mouth when lying flat, which is a sign of significant fluid on the lungs and needs urgent attention. But for many young patients, that dramatic nighttime symptom simply doesn't appear until things are quite bad. And physically, young patients with this kind of presentation often don't look fluid overloaded or puffy the way that an older patient might. They often look pale, grey, unwell in a way that's hard to name specifically, which again doesn't fit the picture anyone else is looking for. But what should be obvious is that these patients are not thriving. So, what happens is entirely predictable. A young person presents with fatigue, weight loss, poor appetite, maybe some abdominal discomfort, looking pale and unwell, and without the swelling or the breathlessness that would immediately raise the alarm for heart failure. They get told it's a virus or anxiety, or distressingly often in young women particularly, they get questioned about disordered eating, because unintentional weight loss and poor appetite can look similar on the surface. And none of those explanations are unreasonable starting points. But when the symptoms don't resolve, when something still feels wrong, the diagnosis needs to be pushed further, and heart failure needs to be actively considered, not just eventually stumbled on. Here's what I want you to know if this sounds familiar, either for yourself or someone you love. If you are under 50 and you have persistent, unexplained fatigue, unintentional weight loss or gain, loss of appetite, or right-sided abdominal discomfort that hasn't been explained by anything else, and especially if you've noticed your blood pressure running unusually low, this combination deserves a heart failure workup. Specifically, ask directly for an echocardiogram and ask for an NT-proBNP blood test, which measures a hormone released when the heart is under strain. These are not exotic tests. They are quick, safe, and can very clearly point towards or away from a cardiac cause. You do not need to diagnose yourself, but you are allowed to ask a direct question. Could this be my heart? And can we rule that in or out? If the answer you get back is dismissive, without that basic testing having been done, it is entirely reasonable to seek a second opinion. If you have been diagnosed with a new cardiomyopathy as a young person, there's one more thing that matters enormously, and I want to say it clearly. Early assessment for advanced therapies, including heart transplant assessment, should be part of the conversation early, not as a last resort after everything else has failed. This isn't because transplant is inevitable or even likely for most young patients. Many respond very well to standard guideline-directed medical therapy and improve significantly. But new onset cardiomyopathy in a young person can occasionally progress quickly, and being connected early with a centre that has full transplant and advanced heart failure capabilities, a tertiary or quaternary centre, means that if things do progress, you are already in the right place with the right team, rather than needing to be transferred urgently later. This is genuinely one of the most important pieces of self-advocacy for a young patient with new heart failure. Ask specifically whether your care is being managed at or in close consultation with a centre that offers advanced heart failure therapies and transplant assessment. And if everything goes well, you can stay with your current providers. This could be for years before you need referral. But if it's not going well, early referral is critical. Let's bring this together. Heart failure in young patients often looks different. Low blood pressure rather than high, fatigue and weight loss rather than swelling, abdominal discomfort rather than breathlessness, a pale, unwell appearance rather than the obviously fluid overloaded picture that most people expect. That difference is precisely why it gets missed, misattributed to anxiety, a virus, or disordered eating, and why a diagnosis is so often delayed in this group. And if this sounds like you or like someone you love, ask directly for an echocardiogram and a brain natriuretic peptide blood test. Don't accept a dismissive explanation without them. And if you're newly diagnosed, ask specifically about assessment at a centre with full advanced heart failure and hopefully transplant capabilities. My free Heart Failure Stage Guide has a set of questions worth taking to that first cardiology appointment, including questions about which centre is managing your care. It's linked in the description below. Subscribe for a new video every week, all designed to give you the clarity your appointment didn't.